Well, hi, good afternoon. It's Tom Worhach with United Way of Steele County. I'm the Community Impact Coordinator with United Way. And I've got a great guest here, Mary Harders. Mary, thanks so much for joining us.
Thanks for having me.
Mary, we just want to begin by sharing with folks what organization you're with and what you do.
So I work for Crisis Response for Southeast Minnesota. It's an organization that started about 4 years ago when the state of Minnesota wanted a mobile mental health unit in every county within the state. The way that Crisis Response is formed is it's the Crest region, which is the 10 counties in Southeast Minnesota, and they've come together to create Crisis Response, which is the mobile response unit for the area. They broke it up into three separate hubs in order to provide for a better response time due to the demographics of the region.
Hmm.
So Hiawatha Valley partnered with Zumbro Valley Health Center and Olmsted County and South Central Human Relations Center. So Hiawatha Valley covers the eastern hub, and then Zumbro Valley covers the central hub out of Rochester, and then South Central Human Relations Center covers the western hub out of, well, there are three offices in Waseca, Owatonna, and Casson. So we also serve in the western hub, Mower County.
Okay, great. Thanks for that breakdown. It's actually really
Yeah.
helpful. South Central Human Relations was kind of the organization that referred me to you. So I appreciate you kind of connecting the dots and
Yeah.
talking about how you're helping to serve Owatonna. So I guess the first question that I have for you, and the question we've been getting a lot is, have you seen an increase in calls requesting assistance in response to COVID-19?
So, that's kind of a two-part question, because I think that, one of the things that we've been hearing nationwide is that there is a lot more mental health issues coming up after, the start of COVID-19. And I think that we are seeing a lot of people who are struggling with some of the situations they're in due to COVID-19. And it's
Hmm.
definitely adding to, the layers that people are experiencing anyway. I will say, though, that we haven't had an increase of calls to our organization since the beginning of COVID-19. However, we do know that people are struggling, whether they're, calling us, and that's a part of what's going on with them, but also the people who maybe are struggling and haven't called or haven't reached out to get help. We think about, some of the roles that people are taking on, working in their homes, parenting and working, and maybe homeschooling at the same time, which hopefully we're hoping to see some stress decrease as schools let out here and kids are able to, go about their, summer activities. So
Yeah. Well, that's an excellent segue into the next question that we've been getting a lot is, what are some of the best outlets that members of the community can use to help reduce stress during the coronavirus?
I've attended a number of webinars. I mean, this was a really great time for people to explore other ways to communicate and connect. And one of the things that was said was, really make sure that if you're normally see that person face to face sort of socializer, that you're connecting with people over video. If
Hmm.
normally you talk to people on the phone, connect with them over video. If you normally text, try and make phone calls. So, part of the point was is they tried to move from social distancing to physical distancing, because they didn't want people to get the impression that you can't keep talking to people, you can't keep seeing people. Even with some of the regulations that are in place, we've been seeing people go up to windows of people's houses and talk to them through the windows. That's really important, especially for our elderly population. But also, I know that kids have connected with family members that way. And I think it's really important that people continue to try to explore ways to continue to communicate, even though some of our guidelines have opened up, but to continue to be safe about it. Um,
Hmm.
because I think that people are thinking, well, I'd really like to have that birthday party or that graduation party would be a really good thing. But knowing that when people get together in large groups, that they're still very vulnerable in those times. So That connection is really important. The other things that we have really stressed on is healthy eating habits, really
Mhm.
promote good mental health, as well as sleeping habits. I just was in a webinar yesterday where they talked about how if somebody is deprived from sleep, that all the symptoms it can show, and including signs of Alzheimer's. And they did
Mhm.
this study on a 20-year-old male who was in
Wow.
good health. And so I think that it's really important that we recognize that good sleep is important, and developing a routine before you go to bed. I think it's a lot easier in a time like this for people to think, oh, well, I can stay up later because I don't have to get up so early to go work out of my living room. I've talked to professionals who have said, I got really lax in my morning habit. Like I wasn't showering, I wasn't eating breakfast because I was going to get to that later. And so, really keeping a routine and habit is really important. And so, we want people to be able to schedule in breaks and not take their whole day as, kind of a working break as they're
Mhm.
going throughout their day, because it's really important to keep that routine for your mental health. Um, Especially for kids as well. So that's one of the hard things, I think, when parents are trying to struggle, is continuing to parent at home and work from home, and having a designated work area, they think is really important. So if you can have a place that, is set up for you to work, is also highly recommended.
Mhm. Well, those are some fantastic tips. This next question, you may have touched on them, some of the answers, but one of the other questions that we've been getting a lot is if community members start to see warning signs of depression or stress setting in for their loved ones and neighbors, what can they do to help?
Definitely. One other piece that I want to add just from the last question, but that also includes in this, is to get out and be active. That
Mhm.
exercise piece is really important. And I think that, going on walks with people, getting them out to schedule things to do with them is important. As long as, you're able to stay safe doing that. But then also, just being able to listen to that person and hear kind of what's going on with them is important. I think that people a lot of times don't want to talk about their problems because they don't want to burden other people. And so
Yeah.
as people notice signs that their loved ones are, maybe seeming depressed or anxious, that they're able to just talk to them about it and say, this is what I'm seeing, and I want you to know that I'm here to listen to you. I'm
Mhm.
here to help. You're not the only person in this situation. The number of people who experience depression in a lifetime is pretty significant. We know that at least 7% of people have reported having a clinical depression within the last year. That's underreported because there's so many people who don't seek help for when they're experiencing troubles. And
Mhm.
so really just letting people know that there is help out there. We have the NAMI warm line, we have the crisis response number, and we have a crisis text line. So there's a number of resources for people to call to find out, like, well, what are my options. And I think a lot of times people think, well, I don't even know where to start, I don't know what to do. And so when they hear crisis response, they think, well, I'm not having a crisis. I'm just, really struggling right now. And we want people to know that they can call that number anytime and find out, like, well, this is my situation. Now, what do I do? Where do I go? And so we can be a first step for people in order to know what organizations are available in their community, what services are available to them, and then how to get connected to that. And we actually help with those steps to get connected. And so we don't want people to feel like, well, I'm not suicidal, so I can't call that crisis line. That's not necessarily, if your normal level of functioning is pretty high and now you're struggling, that can be a crisis for you. So don't feel that, don't let the name deter people from reaching out and getting the support they need.
Yeah. Well, that's fantastic. Thank you so much for sharing some of those resources and answering some of the questions that have been on members of the community's minds here as we move through this stay safe order. So thank you so much for your time this morning.
Thank you.
Okay, we appreciate it. Take care.
You too.